Joint pain is an interesting animal. Everyone has it at some point. For many people, it's only an occasional problem, easily taken care of by a single aspirin or some Bengain or an herbal deep tissue oil, for that matter. For others, though, it's a chronic problem, reducing them to a lifetime of dependency on high doses of NSAIDS or prescription drugs. Over the years, I've formulated and recommended a number of products for pain. Years ago, before they were all the rage, I recommended glucosamine and chondroitin sulfate. Also over the years, I've recommended CMO, cetyl myristoleate, MSM, fish oil, Boswellia, and proteolytic enzymes, among others. Why so many? Because no one solution works for everyone. That's so important, I'm going to repeat it. No one solution works for everyone. If glucosamine and chondroitin already serve your needs, then this report is not for you. But if they haven't worked, or if you still suffer from chronic pain and the only help you've been able to find is from daily doses of aspirin or prescription drugs, or if you're concerned about more than just pain and are looking to prevent further degradation of your joints, then you've come to the right place. What we're going to be talking about is how you can attack the problem on multiple levels so that you can give your body the specialized nutrients it needs to repair and rebuild damaged joint cartilage, reduce inflammation, and lubricate joints to eliminate pain while your joint cartilage is repairing itself. With that in mind, we're going to look at 5 specialized ingredients, a couple of which you may never have heard of before. Individually, each one can be used to help with joint pain, and have been by many people. When used together, though, they produce a result that is notably greater than the sum of its parts, and may provide the relief you're looking for. We're talking about Avocado Soy Unsaponifiables, ASU, UC2, Undenatured chicken collagen, ginger, CMO, cetyl myristoleate, and Boswellin PS. Let's now take a look at how these 5 joint pain remedies complement each other when used together. To understand ASUs and how they work, we need to first look at aggrecan, the short name for a biochemical called the large aggregating chondroitin sulfate proteoglycan. Specifically, an aggrecan molecule consists of a protein backbone which is attached up to 150 chondroitin sulfate chains and 60 keratan sulfate chains. Aggrecan is abundant in the human body and represents up to 10% of the dried weight of cartilage. As many as 100 of these aggrecan monomers will then interact with hyaluronic acid molecules to form a single massive chain called an aggregate, which is a key component of joint cartilage. Aggrecan plays a crucial role in the functioning of articular cartilage, the cartilage found in joints, primarily working to maintain high levels of hydration in the cartilage, thereby keeping the cartilage healthy and functional. As a side note, it is the presence in aggrecan of large numbers of chondroitin sulfate chains that is primarily responsible for the osmotic pressure that results in articular cartilage being 75% water. When at rest, such as sitting down and watching TV, the osmotic swelling in the articular cartilage is at a maximum. However, when walking or standing, the weight of the body is transferred to the articular cartilage found at the ends of the long bones. At this point, your weight compresses the cartilage, literally squeezing the water out of it. This continues until the osmotic swelling generates a force equal to the compressive force in the cartilage generated by your weight. When you sit down again, reducing the load, the compressive force is removed and the cartilage once again swells to its full extent. The more aggrecan present, the better able your body is to perform this function. Note, the reason people supplement with chondroitin sulfate and glucosamine sulfate is to increase aggrecan levels. They are components of aggrecan, and it is aggrecan that lies at the core of cartilage health. But, as it turns out, there may be a more efficient way to increase aggrecan levels. In 2003, French researchers reported that an extract concentrated from the oils found in avocado and soybean fibers could significantly boost production of aggrecan, thereby helping slow down and even repair some of the damage caused by osteoarthritis in as little as 9 days. It is only the special compounds found in ASU extract that restore aggrecan synthesis blocked by the inflammation-causing compound interleukin-1 beta. In other words, ASU is not the same as avocado and soy oil. It is specifically extracted from the fiber of avocados and soy. The problem is that before extraction, the ASUs are so tightly bound to the fiber that they are mostly unusable by the human body. It also should be noted that the benefit is only achieved when the special compounds from both avocados and soy are used, and when they are used in the correct proportion. Double-blind studies have proven that the use of ASU significantly improves arthritis symptoms, both short-term and long-term. Incidentally, studies have shown that ASU helps protect both the periodontal ligament and oral bone cells, as well as the elastic and pre-elastic fibers that help hold your teeth in place from the corrosive effects of gingival inflammation and periodontitis. Although ASU works directly to build and repair joint cartilage, it doesn't address a major aspect of the problem. In fact, few things address this particular aspect. A key component of most joint destruction, sometimes an initial cause, as in rheumatoid arthritis, and sometimes a secondary factor triggered by an initial trauma to the tissue, as in osteoarthritis, is when the immune system goes out of control and starts attacking the cartilage. In other words, once a person starts down the road of joint pain, either early on or later in the process, at some point, the immune system usually goes wrong and becomes a factor in the gradual destruction of joint tissue. Literally, the immune system reprograms itself to treat joint tissue as a foreign invader and eat it up. Reprogramming the immune system through the use of immunomodulators is often an essential step in stopping and reversing this damage. There have been a number of studies conducted with UC2 on both animals and humans, including research at the Harvard University Medical School, all of which have shown that the undenatured type 2 chicken collagen found in UC2 effectively reprograms the immune system to promote healthy joints and increase joint mobility and flexibility. Small amounts of UC2 taken orally have been shown to correct a faulty immune response specifically targeted at the type 2 collagen present in bone joint cartilage. In effect, modulating the body's immune response so it works correctly once again. And for those suffering from rheumatoid arthritis, studies have shown that small doses of undenatured type 2 collagen can indeed deactivate killer T cells of joint cartilage in humans. For anyone suffering from progressive cartilage damage, which ultimately means anyone suffering from rheumatoid arthritis or long-term osteoarthritis, reprogramming the immune system with an undenatured type 2 chicken collagen as found in UC2 is an essential component of his or her joint repair regimen. The COX-2 enzyme plays a key role in the inflammation process, which is a normal, healthy attempt by the body to heal itself. However, when inflammation gets out of control, such as in the case of arthritis or other chronic inflammatory disorders, ongoing pain and discomfort is a result. A botanical COX-2 inhibitor, such as found in ginger, can block the action of the COX-2 enzymes in much the same way as prescription drugs do, but without the side effects. Although it's probably better known for its anti-nausea properties, ginger is an effective COX-2 inhibiting anti-inflammatory herb that has historically been used for arthritis and rheumatism. In a study of patients with rheumatoid arthritis, osteoarthritis, and muscular discomfort, the majority of those who received ginger experienced relief of pain and swelling. Another double-blind study found ginger extract to be effective at relieving pain in people with osteoarthritis of the hip or knee. Likewise, in another double-blind study, ginger was significantly more effective than a placebo in pain relief and overall improvement. The bottom line is that ginger's anti-inflammatory benefits, which include reducing pain and inflammation, help minimize any further degradation to joint cartilage, thus allowing ASU an opportunity to repair existing damage without having to fight through new damage. Cetyl myristoleate, CMO, is a relative of the omega-9 fatty acid found in olive oil. Studies have shown that it protects against arthritis. The first double-blind study was conducted in 1997 under the auspices of the Joint European Hospital Studies Program and published in the Townsend Letter. Of the 106 people who received cetyl myristoleate, 63% showed improvement versus just 15% for the 226 people in the placebo group. In 2001, a study of just over 1,800 arthritis patients found that over 87% of the subjects in the study had greater than 50% recovery, and over 65% of those showed from 75% to 100% recovery following a 16-day regimen. And in 2002, a double-blind study of 64 people with chronic knee pain, published in the Journal of Rheumatology, concluded that CMO provided a significant functional improvement in range of motion versus placebo. In fact, the study concluded that CMO may be an alternative to the use of nonsteroidal anti-inflammatory drugs for the treatment of osteoarthritis. CMO provides 4 distinct benefits. First, it serves as a lubricant for the joints and muscles, virtually equivalent to silicone in its effectiveness. It facilitates the rebuilding of cartilage. It functions as an immunomodulator, helping to stop an errant immune system from attacking joint cartilage. And it functions like the fatty acid that it is, in that it mediates inflammatory processes. Which brings us to Boswellia serrata, the Indian version of frankincense, which has been a staple of Ayurvedic medicine from time immemorial for its ability to manage inflammatory disorders. Positive effects of Boswellia have been reported for a number of chronic inflammatory diseases, including rheumatoid arthritis, bronchial asthma, psoriasis, osteoarthritis, ulcerative colitis, and Crohn's disease. Whereas ginger and most drugs function as COX inhibitors, Boswellia works by inhibiting lipoxygenase enzymes, LOX, which are powerful contributors to inflammation as well as a whole host of age-associated inflammation-related diseases, including joint problems, intestinal disorders, cancer, and lung-related diseases. In addition, it appears that Boswellia can inhibit the breakdown of connective tissues caused by tumor necrosis factor alpha, a potent inflammatory agent in the body. And finally, studies show that Boswellia has the ability to modulate the immune system and inhibit inflammatory activity, thereby helping with a number of autoimmune conditions, including rheumatoid arthritis. The bottom line is that a formula based on these ingredients offers a five-pronged approach that can systemically relieve chronic joint pain and inflammation. It incorporates ASU to increase aggrecan levels, thereby helping to repair and rebuild damaged cartilage in the weight-bearing joints. It makes use of the unique ability of the Undenatured type 2 chicken collagen found in UC2 to train the body's immune system to stop attacking joint cartilage. It makes use of ginger's ability to directly reduce pain and inflammation as a COX-2 inhibitor. It makes use of CMO's ability to lubricate joints, to support the rebuilding of cartilage, and to help the immune system from attacking joint tissue. And it makes use of the ability of Boswellia to control inflammation as a LOX inhibitor. As we mentioned at the beginning of this report, if glucosamine and chondroitin already work for you, then this kind of formula is not for you. It's more expensive than generic glucosamine and chondroitin. But if glucosamine and chondroitin haven't worked for you, or if you still suffer from chronic pain, and the only help you've been able to find is from daily doses of aspirin or prescription drugs, or if you're concerned about more than just pain and are looking to prevent further degradation of your joints, then a formula like we've discussed today just might be the miracle you're looking for.